Okay, so Assalamu alaikum to both of our speakers for today. We have Samina Vertejee. She is a public health nurse and assistant professor and lead geriatric group from Aga Khan University School of Nursery and Midwifery, Pakistan. And Rahim Anwer is the co-founder of Healthyabi. First of all, thank you both for coming here and talking to us for TAF Foundation. And सबसे पहले I just want to ask you, how are you both, and how are you holding up with the whole unfortunate situation that we are in? Samina ji.
Assalamu alaikum, and thank you so much for inviting me, and in fact me as a panel with Rahim here. I'm so glad to be here. First of all, let me tell you one thing. Yes, it may be unfortunate situation, but let's see it as a positive thing. That it is, a time when we are coming back to our square one, trying to improve things, trying to redo things, trying to, straighten out what we have not been able to do. I must say that this is a time when I really enjoyed working from, at, and for home. So yes, we are suffering. At the same time, we are really doing so many good things. I must say for last 5-6 years, my pots were, I used to have all pot plants and things were empty because I had a very good excuse that I don't have time to, rearrange them, to, decorate them again. But this time I really got plenty of time to really replenish everything. So it's a positive, while it is a negative aspect, but it is a positive aspect as well, that it is giving us an opportunity to spend time with family, to spend time at home, at the same time you're working. Believe you me, every single day we are working, but have good time with family.
Rahim, आप थोड़ा सा बताएं also about Healthyabi, what you do and how are you holding up with this pandemic?
Yeah, actually, Healthyabi के बारे में home service provider, and we provide any kind of medical, non-medical assistance to patients at the comfort of their home. And majority of our clients are people with elderly age to provide them care. So this is a core competency and as well as our core work of our business. Right now, in a pandemic situation, yes, we are also suffering. Not because of that से impact ज़्यादा नहीं हो, उसी के जितने भी नहीं होती है, market depend करती है दूसरे businesses के ऊपर. Every market depends on other businesses. So when the purchasing power of the people will decline, will not be able to afford the home care services, because home care services are not cheap, they are also expensive. And second is that when the people are at home, so they would like to take care of their parents themselves. And so yes, we as a business, we have also been impacted. But at the time, always there are two parts of business. Therefore, we can move from one direction to another directions. So we have certain plans in our business and we are coping up with them.
Okay. Samina ji, I'll come back to you. So I wanted to ask you about generally health practitioners, where do you think they're standing? Because obviously COVID aside, we do see that doctors, nurses are working at that front. But we cannot ignore exactly as Rahim said कि और भी बहुत सारी needs हैं लोगों की. So how do you think trainers हैं, caregivers हैं और दूसरे sector में हैं? So how do you think उनका coping mechanism is? What do you think? How will they cope up with the whole pandemic situation?
Zaina, this issue of health professionals, we have very clearly heard from Rahim as well, and this is also one of the I can say stressing situation for some of the health professionals. I guess some some are engaged at workplace, but some those who have been on call, they are going through this issue of you know, decline in their wages and things, while the stress of catching the infections while caring for people. Yes, it is a stressful situation. And on top of it, actually the question has a lot of other just give me a moment, let me put the phone silent. I'm so sorry about it. Yeah. So if we go back to the question, and let me restart it this way, health professionals is a global issue. Everywhere in the world, leave alone COVID pandemic now, everywhere in the world there's a shortage. And with that shortage, the number of health professionals which are working, they are overwhelmed with the work. I'm not talking about current situation. I'm talking about general situation where people are suffering, a lot of work because of the shortage of healthcare providers. Now, when it comes to pandemic means that globally the disease is spread, right, everywhere, and that means there's a great need of healthcare providers to look after the sick people. And a few days back, I was reading one post, and it really touched my heart. And I'm sure it is a cry from every healthcare provider that you or any other healthcare provider, we are taking care of sick people in the hospital, but we are scared to go back home because I know if I am taking care of a COVID positive patient, when I go home, I do not know whether or not I'm carrying that infection with me. Will I be able to hug my child? Will I be able to go and shake hand with my loved ones? So this is a stressful situation for every healthcare provider in the situation where there is an overwhelming work. At the same time, the PPEs, personal protective equipment, are not sufficient enough to help me or any other healthcare provider to protect from COVID. So at this time, it is a very dangerous situation globally. But when it comes to developing countries like us, we are even in a very bad situation where from the beginning, always the budget for health has always been, very less as compared to if you see other sectors, especially the defense. You can see what a great difference. If defense is 20%, so we have hardly 1 or 2 or 6%, which is way too different. So imagine in that situation when we have less budgeted situation and the pandemic situation, and the amount which is already small, that amount is it rightly utilized? Does it go to the people where it should go to? That's a challenge to our country. That is why we are suffering. In our country, our healthcare providers are dying. They're not only dying, they are mentally stressed. But what I can say as a nurse, as a healthcare provider, don't take it so bad. In the beginning, I said that yes, while it is a negative situation has occurred to our life, see it as a positive. It is really giving us a moment to cherish the time with our loved ones. So when I'm at the hospital, I'm with patients. When I go home, I make sure as a nurse, I'm giving this message to every healthcare provider, whether a nurse, doctor, or a nursing assistant, or even other people, leave alone healthcare providers. We see security guard, we see cleaners, we see laboratory technician. Everybody is in contact with these patients. So when you go home, make sure that you're clean enough to go and sit with your family, cherish time with them. So let's be positive. Spend time with the family, be happy, and be relaxed that yes, we are with the family. Still, we are good enough to cherish, we are good enough to smile and laugh and talk rather than just cry.